Hi, I'm Dr. Hamilton-Stubbs, and this is Dr. Hamilton-Stubbs Sleep and Total Wellness Institute. I'm the chair of the Virginia State Conference of the NAACP Health Committee, and I also chair the Virginia chapter of the International Association of Ministers' Wives. This is intended for these organizations and our patients, and we welcome anyone who's interested to join in. These talks are offered on Tuesday afternoons, which I try to keep them short, so from 12 noon to about 12:20. And afterwards, they are kept on our Facebook page, moved to our podcast, Minding the Temple, which is available with captions, so we can provide this information to people who are visually impaired and hearing impaired. Today I want to talk about PPE. What does that mean? And what does it include? I want to give you an update on your mask, some things you need to take into consideration when you are using a homemade mask, and or just wearing a mask that maybe you did purchase or someone purchased it for you. We'll also give you an update on the new symptoms that had been added to COVID-19, so you can be aware of what to look for and when you should seek additional medical advice. PPE stands for Personal Protective Equipment. This includes your gown, mask or respirator, goggles or face shield or gloves. What some people don't realize is that the CDC has a recommended way of putting these on, a sequence, and a sequence for taking them off. This is important if you have someone at home and you've been instructed to wear PPE. Most of us are not wearing gowns, face shields, or goggles, but we are wearing masks and gloves. So the sequence, when you want to put on your personal protective equipment, you will put on your gown first. This is followed by the mask, your goggles or face shield, and then your gloves. When you want to take off your PPE, you take off the gown and the gloves first. These are considered to be contaminated, the front of the gown and your gloves. Then you take off your goggle and your mask. When you want to wear your mask, and I have one here, this is just a surgical mask that we happen to have these in our office, and this is what I see a lot of people wearing. This is not an N95, but you want to make sure that it's fitting over the nose, behind the ears, pull it down under your chin, and it should fit snugly on the sides of your face. If you have problems with your glasses fogging up, what I found is if I press this to my nose, which you should be doing, and make sure my glasses are right there on the top of it, I don't tend to get the fogging of my glasses. When you want to take off your PPE, you're going to remove it with the earlobes first, and don't touch the front of it. If you are wearing a mask, it's recommended that you don't wear makeup because the makeup will contaminate your mask, and it's hard to get the makeup off your mask. So here's how I take it off. Just pull it right here, and then I sit it on a piece of newspaper, brown paper bag. If you're storing it because you need to reuse your mask, it's better to store it, in my opinion, on some paper, because the virus only lives about 24 hours on paper. But if you're putting it into some type of plastic bag, the virus lives longer in that plastic. So if you put it on paper, put it where it can get exposed to the sun. There's some thinking that the UV lights from the sun will also help to kill the virus. be aware that many of our windows have been treated so we're not getting UV exposure behind some glass windows. Next, I want to talk to you about, if you're making masks, some things that you want to be aware of. When you make your mask, the fabric you use is important because stretchy fabric like t-shirt fabric's been found to stretch to the point where the virus can get in between those fabric fibers. Over time, those fibers are not as closely knit together, and that stretchiness means that it's been compromised. The fabric that I found during my research is that denim works better. And if you are going to make a mask at home, more than one layer of fabric is recommended. What I have seen is to make it so that there's a space between the front layer and the back layer of your mask where you can drop in some type of filtering fabric. This fabric can be part of a nylon stocking. If you're going to use filters, like the filters found in vacuum cleaners or you use in your home to put in front of the vents for your furnace or your air conditioning unit, you must be sure that the filter does not have fiberglass. Fiberglass is very dangerous and can cause you to have lung disease, and it's a risk factor for precipitating lung cancer. So you want to make sure that the filter you're using does not have fiberglass. When you want to clean your when you want to clean your mask, it's recommended that you don't wash your filter unless it's a fabric mask that you have at home. If you have an N95 or you've gotten some surgical mask, especially the N95, when you wash it, you could be changing the static nature of that fabric that makes up the mask, and that will compromise your mask's ability to protect you from the virus. So soap and water is not recommended for washing and cleaning your N95. Neither are disinfectants that you spray or alcohol. What is being recommended is a 6% solution of hydrogen peroxide. The ultraviolet light, I don't know if many of us would have access to that. And there is some ongoing research about the use of ozone to disrupt the outer layer of the virus, and this would make the virus die. I'll get back with you as information becomes available about the use of ozone. The CDC has updated the symptoms that are associated with COVID-19. So if you have a fever, the fever is usually very high. It's best to take your temperature several times through the day because your temperature may be lower in the morning and start to peak in the afternoon. Viruses typically have what's called a cyclic pattern to their spiking. So you won't always get a spike in the morning. You might get your spike in the afternoon. You're looking for fevers over 100. Typically, I'm hearing 101 up to 104. When you get to fevers like 106, you're at risk for having seizures and maybe other neurologic problems. So you want to try to get treatment. Cough. The cough is described as a dry cough. Now this becomes a problem this time of the year because so many people have allergies. This is making it difficult for you to know if it is your allergy causing the cough and the runny nose or if it's COVID. COVID-19 is not typically associated with a runny nose, but the dry cough. If you remove the typical allergens and you're still coughing, then you may want to contact your primary care provider. Shortness of breath, trouble breathing, a persistent pain in the chest or pressure in the chest are considered to be symptoms of COVID-19. And this is because COVID-19 selectively attacks cells that have a receptor called the ACE2 receptor. And the ACE2 receptor is found in your nose, your throat, and your lungs. Once it gets into the lungs, the virus attacks certain types of cells in your lungs, and this can be causing the pain and shortness of breath and trouble breathing. They've also found that the virus can affect the nervous system. Some people have a new onset of the loss of smell. This is something that if you have allergies, you may have compromised ability to smell. But if this is not something that's typical of your allergy symptom, or if it's more severe, then this is a sign that you may have been infected. If a person is difficult to wake up, they feel fatigued or lethargic, that's a new sign of COVID. And blue lips and face is a sign of compromised oxygen level. And those are signs that you need to get to the healthcare provider right away. Testing, at least in Virginia, has become more available. Contact your healthcare provider or the health department to find out if testing is available. You want to call your insurance company ahead of time to find out if the virus testing is covered by your insurance. When you call your health insurance company, be sure to write down the date, time, the name of the person that you're talking to, and the department, and write details on that conversation. So ask them, is this test covered by my insurance? What is my out-of-pocket cost? And are there any kind of restrictions that the health insurance company has that would mean that I would end up having to pay for the testing? This is the end of our talk for today. I thank you for joining. Join us again next Tuesday at noon, where I'll provide you additional updates. Also, I'd like you to know that on our website, www.drhamiltonstubbs.com/COVID-19 is where you'll find our free booklet on influenza and the coronavirus. It is being updated, and a new edition should be out soon. If you're stressed and you need to figure out a way to just to relieve some of the tension and take your mind off the anxiety associated with the coronavirus, please go to our shop and download our free journal on walking. It's an inspirational, gratitude, reflective walking journal that was created so that you'll have a place to record your thoughts, distract yourself from fears of the coronavirus, and just enjoy a nice time walking around your home, outside your house, in a safe area according to the restrictions in your neighborhood. Join us on Instagram if you like some more tips about walking and how to walk safely. That's going to be on Instagram at noon. Instagram, I am Dr. Hamilton Stubbs. I am DRPH Stubbs is our site, and we'll talk with you about exercise, walking tips, and then that's followed with lunch with Marcus. Thank you. Stay safe. May God have mercy on us all.